Hi, my name is Hao Lee. I'm an instructor with the Faculty of Nursing at the University of Alberta, and this is a supplemental guide to reading a basal bolus insulin therapy order sheet for acute care nursing. So for basal bolus insulin therapy, the abbreviation, as you noted, is BBIT. And you can check the www.bbit.ca website for further information that will help you understand the purpose of basal bolus insulin therapy and the prescriber guidelines in your nursing role. So the main components are the basal piece, which is actually the long or intermediate acting insulin, and that is the insulin that will help maintain your blood glucose while the patient is fasting. And then you'll also have the component of the bolus insulin, and that's the shorter rapid-acting insulin that will balance the carbohydrates when the patient eats. So generally you'll see the basal insulin given at breakfast or at bedtime, and then you'll see the bolus insulin given at meals or when the patient has tube feeds. So that's generally at breakfast, lunch, and dinner time. The last component to this is there is a correction table for insulin, and that's additional short-acting insulin that is used to make little small corrections to continue to bring the blood glucose back to the target range. Okay. The other thing to note is that in hospital, the target range for blood glucose is actually 5 to 10 millimoles per liter, and that's going to be a little bit higher than what you'd see in the community. This is an example of an Alberta Health Services basal bolus insulin therapy order set. The one thing to note with this order set is that it's actually for adult inpatients on subcutaneous insulin. So what that means is that the patients are getting their insulin via subcutaneous injection. In most cases in large cities and large hospitals, currently patients are generally given their insulin through an insulin pen. You'll learn more about how to use the insulin pen in your lab theory and lab practice. In some of the smaller, more remote hospital sites, you might still see nurses giving the insulin from drawing it up with a needle and syringe from a vial. So that still exists in some cases, so it's good to know how to administer insulin in both methods. The other thing to tell you about with the order sets is that sometimes they'll look different from hospital to hospital. So for example, the order sheet between the Royal Alec Hospital and the University of Alberta Hospital actually look different. The overall concepts of BBIT remain the same, and the overall content generally looks the same, and it covers everything that you'd normally see in the order sheet, just that it sometimes might look a little bit different. So there are two things that I'll actually recommend that you always check in the beginning when you're using this order sheet. And the first piece is double checking that patient label. So just to be aware that in an acute care setting, there's a fair amount of patients that have diabetes. So you want to make sure that you have the right patient and that you're administering the insulin to the correct person. And that's perhaps one of the most important things to do. The other thing that I'll actually recommend that you check is if you actually go to the very bottom of the sheet, that you actually double check the date, the time, and make sure all the orders are up to date. So keeping in mind that patients sometimes will have a couple different versions of the order sheets or order sheets that are rewritten. So you want to make sure you have the correct order sheet. Now, in most cases for best practice, if there's an old set of BBIT order sheets, they'll all be crossed off and they'll be marked as do not use. But that isn't always the case. So again, before you actually read the order sheet, you want to make sure you have the right patient and that you have the most up-to-date BBIT orders. So those would be the most important things to do for overall patient safety, especially knowing that insulin is a high alert medication, which means that if you actually administer it incorrectly, then it could have some serious effects. The other thing it'll indicate on the order sheet, going back to the top box there, is it actually highlights the blood glucose monitoring procedure. And in hospital, it's actually fairly standard of doing the blood glucose monitoring 4 times per day, 15 to 30 minutes before scheduled meals and at bedtime. So that's generally standard practice. So that box is actually already checked off. Now, if there are any other things where there's alterations in that monitoring procedure, the doctor will specify those orders. And of course, if you suspect any issues of hyper or hypoglycemia, you can also monitor the blood glucose PRN at your discretion in terms of maintaining patient safety and obtaining the most current information about their blood glucose status. If the patient does have a blood glucose less than 4 millimoles, then you're going to initiate the hypoglycemia procedure. In most cases, you're going to be looking at administering some type of a carbohydrate. And there is an Alberta Health Services protocol on that, and you'll actually learn more about that in your nursing lectures. And so you'll understand how to administer the carbohydrate and how to manage hypoglycemia. And in the case of a patient that has a blood glucose of 18 millimoles or higher, then you're going to initiate the hyperglycemia protocol and then call the prescriber. In this case, you're generally going to anticipate that the physician would order some type of a fast or rapid acting insulin to help decrease that blood glucose so that you can help manage or prevent diabetic ketoacidosis. Okay. So the next piece to the blood glucose BBIT sheet is the total daily dose of insulin. Now that's actually something that the physician will actually determine, and they'll actually determine that based on a variety of factors that you'll be covering more so in lecture. They'll actually talk more about hemoglobin A1C, which is the average blood glucose over the last 2 to 3 months. And then they'll actually base that on the patient's weight, their glucose control, whether the patient's NPO for any lab tests, procedures, or for surgery, and then their overall diet. So how regular is the diet and what's their diet consist of. So the physician will actually take that into account when actually prescribing the daily dose of insulin, and then they'll write the number into that box. So for your own information or your own interest, if you want more information on how the prescriber is actually selecting the total daily dose of insulin, if you take a look at the BBIT sheets and flip them over to the reverse side, they'll actually have the prescriber guidelines. As a registered nurse, you don't necessarily have to memorize that content, but it's just something that's nice to know for your own learning in terms of all the patient factors that affect their insulin requirements. The next piece to the basal bolus insulin sheet is the basal insulin column. So under the basal insulin, it'll actually specify to choose a specific type of basal insulin. So in this case, the doctor will select whatever type of insulin they prescribe. And then they'll also indicate and check off whether they're getting the basal insulin with breakfast and at bedtime. And then as an example here, they'll all actually write in the specific units. So let's say the doctor prescribes 10 units of insulin to be given at breakfast and at bedtime. With all of these BBIT order sheets, there's also an alternate time box that can be checked off. We don't commonly see that box checked off because most of the time we're giving the insulin at relatively standard times in the hospital setting. However, that might apply more so in a patient with diabetes who's managed in the community, for example. So let's say you have a patient in the community and traditionally they eat breakfast at 10 a.m. rather than the hospital time where we usually have breakfast at 8, then again you might have the alternate time marked off in that case. And again, they're trying to customize this BBIT order sheet so that we're meeting the patient's needs to the best of our abilities. The other piece to the BBIT sheet that's next is the bolus and correction insulin. And with the bolus and correction insulin, the thing to look out for is that you actually are using the same type of insulin for both the bolus and correction insulin. So it's the same insulin. And then the doctor will have checked off whatever type of insulin that they prescribe. Furthermore, with the bolus insulin, if you move down to the next box, they'll actually check off whether they're getting the insulin at breakfast, lunch, and at dinner. So often those boxes will be checked off, and then there'll be a specific unit amount that's actually written into the sheet. There is also an alternate time box for the time as well. Sometimes you might see this checked off or marked off with a specific time. If you have a patient that's on enteral feeds via PEG tube or an NG tube, and the feeds are outside of the regular breakfast, lunch, or dinner time. So let's say the patient's getting a tube feed at 8 o'clock, 1400, so 2 p.m., and maybe at 1800, then they might actually have specific times, and that again alters the time that you're actually going to give that bolus insulin. The other piece to highlight with the bolus insulin column in the box that we're currently in is it actually specifies hold if no caloric intake if the patient's NPO or the bolus feeds are stopped. Okay, so that means that if the patient isn't eating, the patient doesn't have any caloric intake, that we're not going to give any bolus insulin. And of course, if you think about it, that wouldn't make sense because if we give insulin to someone that isn't eating, we're actually putting them at risk for hypoglycemia. Okay, so instead, the order actually says that we're going to continue with basal and correction insulin. So we'll give the basal and then any correction insulin just to manage their blood glucose status. The next piece to this is that we're actually going to look at the correction for hyperglycemia box. And in this case, the doctor will have checked off a particular box that's based on the total daily dose of insulin. And their best practice is to actually cross off the remaining boxes just to ensure that the nurse that's administering the insulin is reading the correct box and that there's no mistakes, or we're trying to reduce any errors of reading the wrong box. So the best practice is to check off the one box and X off or cross off the other remaining boxes to make it easy to read. When you're actually reading this, let's say the patient it's at breakfast time, and let's say you're looking at whether or not you need to give correction insulin. Let's say you take the patient's blood glucose and it actually is, let's say 8.6. So if you think 8.6, you're actually looking at the correction box and it actually falls between 4.1 and 9.0. So that 8.6 reading of blood glucose means that you're actually not giving any additional correction insulin. You'd just be giving the 8 units at breakfast. So you're taking the bolus insulin dose, and then based on their patient's blood glucose, then you're actually going to look at the appropriate box in the correction area and then determining whether or not you need to add any correction insulin to that bolus dose. And that's generally how you read the basal bolus insulin therapy order sheet. And as we move through this presentation, there'll be an opportunity for you to answer some of the questions, and we'll actually go over the answers so you get a little bit of additional practice with that. Okay, so the next steps here are we actually will go through a few example problems, and we'll actually go over the answers so that way you have an idea of how to read the order sheet and how to utilize it. So I've actually only cut out the most important piece of the order sheet for you as a RN to look at. I mean, the whole order sheet is important, but for purposes of practice, it's just easier to focus on the areas that you as a registered nurse will need to read. As you can kind of see here, we've got the basal insulin here and its glargine that's been checked off, and then it also specifies 23 units at breakfast and 22 units at bedtime. For our bolus and correction insulin, it specifies Lispro as our bolus or correction insulin. Again, it does say hold if no caloric intake, MPO or bolus feed stopped. And then it actually specifies with breakfast, lunch, and dinner for each of those meals, it's 15 units of bolus insulin, which is the Lispro. As I pointed out before in the previous slide, the boxes that we are not using for the correction insulin are actually X'd off. And you can see it's that fourth box here that's not X'd off, which indicates our correction for hypoglycemia. So before we reveal the answer, if you want, you can actually pause this video, take a few moments to actually answer the question that says it is breakfast and your patient's blood glucose level is 16.7. So how many units of insulin would you administer? So if you want, you can pause the video briefly to answer that question, and then the next slide will actually go over the answer. Okay, so the answer to this question is 23 units of glargine Lantus insulin and 23 units of Lispro Humalog insulin. Okay, so the first thing we'll look at to read this order is we'll actually take a look at the basal insulin. And remember that it is breakfast time. So breakfast time, so we'll take a look and make sure that we've got the right insulin there. So the glargine insulin is checked off, and because it is breakfast time, we're giving 23 units of glargine. In terms of the bolus insulin that we've got here is Lispro insulin that's highlighted. And then we'll have to determine the correction insulin as well. So with bolus insulin, we know it's breakfast time and you're giving 15 units of insulin. With the correction, we're looking at that fourth box there. And with the blood glucose of 16.7, 16.7 falls within that correction box of 15.1 to 17, which means we're adding 8 units of insulin to the bolus dose. The one thing to remember is that with bolus and correction insulin, it indicates that you're using the same insulin for the bolus and correction, which means that the correction dose of insulin is also the Lispro. So that'll give you the answer of 23 units of glargine as the basal insulin and a total of 23 units of Lispro insulin. For that includes the bolus of 15 and a correction of 8, so that makes the 23. Okay, so with this next order set, this is actually the same order set as the previous question. However, we have actually changed the time. So right now it is actually bedtime and your patient's blood glucose level is 9.7. So how many units of insulin would you administer? So if you want to pause the video briefly to answer this question, we'll show you the answer in the next slide. So the answer to this question is 22 units of glargine lantus insulin, and you're not administering any bolus or correction insulin to the patient. So if you look at the box with the basal insulin, it actually will indicate glargine lantus insulin. And remember that currently it's bedtime. So if you move over to the bedtime box, it'll tell you that you're giving 22 units. Now, you're not giving any bolus or correction insulin. If you actually look at the bolus insulin box for the times that you're supposed to give bolus, it actually indicates that you're giving bolus at breakfast, lunch, and dinner. And because it's bedtime, you don't give any bolus insulin, which also means that you're not giving any correction insulin as well. If you actually look at the correction for hyperglycemia box, the second sentence underneath will actually indicate bedtime dose, not routinely recommended. If you think about it, it actually makes sense, because if the patient doesn't have any caloric intake as they go to sleep, giving them a bolus and correction dose of insulin doesn't make sense, because we'd only put them at risk for hypoglycemia while they sleep. So again, not a good idea and not very safe. So the other good thing about the BBIT sheet is that it does have the ability to be customized to the patient. So as an example, let's say you have a patient that's a late night snacker. So they're someone that likes to eat a bag of chips and drink a bottle of pop at 2200 or 10 p.m. So just before they go to sleep, they have a big snack. So if the physician wanted to, and it was a regular habit with the patient, they could actually customize the sheet and add in a small bolus dose of insulin if they wanted to, just to accommodate the patient's dietary habits. So again, it does have the ability to be customized, but again, traditionally that's not the case. In hospital settings, most of the patients will get their insulin at their bolus doses at breakfast, lunch, or dinner. Okay, so this is just a tip or a reminder for you to make sure that you read the order sheets very carefully, so that you know exactly what time you're supposed to administer the insulin and also the amount. Okay. So this is our next question here, and this question indicates that it is lunchtime and your patient's blood glucose level is 15.1. However, your patient is NPO for a diagnostic test and is not eating lunch. So how many units of insulin would the nurse administer? Okay, so again, if you'd like to pause the video briefly, then once I've answered the question, you can unpause and you'll see the answer in the next slide. The answer to this question is that you are not administering any basal insulin, and you're just giving 4 units of aspart novorapid insulin. So the things to remember here, remember with the basal insulin, you're only giving the basal insulin at breakfast and at bedtime. And remember, currently it's actually lunchtime, so you're not going to be giving any basal insulin at all. Okay. With the bolus insulin, remember the one important thing to note with this information is that your patient's actually NPO for a diagnostic test and they are not eating lunch. So they're not having any caloric intake. So under the bolus insulin, the box is actually checked off that you're going to hold their bolus dose of insulin if they do not have any caloric intake and their NPO or the bolus feeds are stopped. Okay, so not eating lunch, so you're not giving any bolus insulin. However, you will continue with basal and correction insulin. Now, because it's lunchtime, they don't have any basal, but with the correction insulin, you're going to look at the correction for hyperglycemia box. And then their blood glucose was 15.1. So 15.1 falls between the 14.1 and 16, which means you're actually going to give 4 units. And remember that the bolus and correction insulin you're giving is going to be aspart insulin. So that's the answer to the question, no basal insulin, and just 4 units of aspart novorapid insulin as correction, because they're NPO for not eating anything at lunch. All right, and in our last example, this is actually the same order sheet as the second question, but all we've done right now is we've actually changed it to breakfast time instead of lunchtime. So to reframe this question for you, it's breakfast time, and now your patient's NPO for lab test and not eating breakfast. So your patient's blood glucose level is 10.4. So how many units of insulin would you administer? Okay, we'll just take a brief pause to answer that question, and then we'll show you the answer in the next slide. The answer to this question is 14 units of Detmer Levmer insulin and 2 units of Aspart Nova Rapid insulin. Okay, so remember that it is breakfast time right now. So under the basal insulin, you can see that Detmer has been checked off, and with breakfast, you're going to be giving 14 units of insulin. So with the bolus dose, in this case, remember that your patient's NPO for a lab test and not eating breakfast. Okay, so for the bolus piece of insulin here, it says hold if no caloric intake and the NPO, and of course continue with basal and correction insulin. Okay, we've already determined what the basal insulin will be, so we'll have to determine what the correction insulin is. So under the correction for hyperglycemia box, we'll actually take a look at what the level would be for the blood glucose of 10.4. So 10.4 is the second box there under between 10.1 and 12, which gives us 2 units. And remember that the bolus and correction insulin are always the same, so you're giving Aspart Nova Rapid insulin. So the answer is 14 units of Detmer insulin and 2 units of Aspart Nova Rapid. And remember that you're not giving any bolus dose because the patient's NPO, so just the correction. Okay, so that was just an example of how to read a basal bolus insulin therapy order sheet. For any additional resources and suggestions, I would definitely recommend taking a look at the BBIT.ca website. If you actually click on the Education tab, it will actually give you further information and videos and additional resources that will help you. They actually have some information on how the BBIT protocols are prescribed. So if you want know more information about the patient factors that affect that information is there. They also have a self-study guide for nurses. And then they also have some pocket guides that you can actually print off and take with you into clinical. And the last thing that they also have there that's important is a glycemic management policy link, and that will actually take you to the Alberta Health Services policies for hypoglycemia, hyperglycemia, and other information on how to manage diabetes. And the other thing to let you know about is that as you continue to progress through your nursing program, there will be medication administration safety screens that you'll take that do have questions that ask you how to read a BBIT order sheet. So again, it's something to be really familiar with and get comfortable with for your future nursing practice. The other last suggestion that I would have is to please take your time and read those order sheets carefully. Now, as you know from being on a clinical unit, there's a lot of distraction, there's people talking, there's noise, there's a lot going on in the units that can be really distracting to you. So please take your time and definitely read those order sheets carefully, because there is a lot of information on there and definitely different boxes that you have to read. And the last thing you want to do is do something that would detrimentally affect someone's blood glucose, so that you don't want to send someone into hypoglycemia. So again, diabetes is something that is commonly out there in the hospital setting, so it's a must-know in terms of your nursing practice. So those would be the general suggestions. So thank you again for watching, and good luck with your clinical.